On this episode, we'll talk about what type of imaging study can you do to visualize your sleeve. We'll also talk about how to know how much excess weight you have, and we'll talk about taking Ozempic 2 years after your gastric sleeve. Is it safe? Hello everyone, I'm Dr. Alvarez with Endobariatric.com. Welcome to episode 253 of the Ask Dr. A Show. Thanks so much for joining us. Thank you for this week's questions. Really interesting questions, by the way. You're always welcome to send me your questions. There's one very easy way, and that is using the hashtag right here on the screen. Ask Dr. A. Use the hashtag. It could be on the comments down below. It could be anywhere on social media that you're watching this. And we're able to grab those questions, add them here to the list. I'll be here to answer them for you very happily to do so. Also, you might consider to subscribe to the channel. Subscribing is completely free. Subscribing will notify you, will let you know when we upload a new episode. That way you don't miss out on any future episodes and we can hang out again. All right, so let's get into the show. Okay, so the first question is, I would like to know, how can I visualize, how can I see my sleeve post-op? It could be 6 months, it could be 2 days, it could be 2 years after, but you want to see your sleeve, you want to see how it looks. There's two ways to look at the sleeve, either by internally, like an upper endoscopy, and see your sleeve by the inside, and there is a way to see it from the outside, and that can be done several ways. Pretty much let's say the easiest way, the cheapest way, is to go to a radiology department, an imaging department, and ask for a barium swallow. That is the easiest, cheapest way. They do the little shake with some barium. You take a couple of sips, and they follow it through from your esophagus. It'll enter your stomach, your sleeve, and exit through the first portion of your intestine. That is the cheapest, easiest way to see the shape, size, or the condition of your sleeve. There's other ways. There's more expensive ways. You can do contrast CT scan with 3D reconstruction of your sleeve, and from there on we can continue. But the easiest way is a barium swallow internally, upper endoscopy. Okay, second question is, I would like to know how much excess weight I have, or how do I know where I stand? Indeed, we as bariatric surgeons, we go by BMI, which is body mass index. Very easy. I mean, if you Google BMI, body mass index calculator, BMI calculator, it will throw you a whole bunch of links right there. Easy. Grab the one you like. It will ask for two important measurements: your weight and your height, and it will calculate your BMI, which is your body mass index. As bariatric surgeons and international guidelines, we always go by the patient's BMI. Is it the only way? No, it's not the only way, but it's a very practical way. So the BMI, it will throw you a number by calculating, depending on your height and your weight. Again, it will give you a number. If that number is between 19 and 25, you stand good. That is the normal weight range you should be in. Is there from over 25 to 30, that'll put you in the overweight zone. Over 30, obesity class 1. Over 35, obesity class 2. Over 40, morbid obesity. Over 50, super obesity. And from there on, super obesity, and so on and so forth. That will help you know where you stand right now. If it puts you, let's say, in obesity class 1 or class 2, and use the calculator to start changing your weight and to get you to a BMI 25. That will throw you or give you the range of how much excess weight you have to come down to a normal weight range. All right, that is the easiest way. Is it the only way? No, it's not the only way, but it's the most practical that even we use that. Third question is, can you use Ozempic 2 years post-op safely? The key here is safely. And the answer is yes. So this is a very specific question asking to use, or if they can use Ozempic 2 years, but it could be 1 year, it could be 5 years, 10 years, it could be 15 years post-op of sleeve. Can I use it safely? The answer is yes. Actually, I use it on my practice, and it's very common. I had a patient yesterday that had lost over 100 pounds, and I did his surgery. I did it over a decade ago. He had a weight regain of 20 pounds out of those 100 pounds. He wants to lose those 20 that he regained. I put him on Ozempic. Patients do really good. Is it for everyone? No. So touch base with your healthcare provider, your bariatric surgeon, if this is something for you, because Ozempic isn't for everyone, but it is a very good tool for patients that have had weight loss surgery, had some weight regain, and nowadays we see less and less revisional surgeries, which means switching or converting one procedure, like a gastric sleeve, to another procedure, let's say a gastric bypass. We have less of those surgeries nowadays due to these medications that are a really good tool for our patients. All right, so there you have it. That is it for episode 253. Send me your questions. Use the hashtag down below. I'll read you in the comments. And if you can smash that subscribe button down there, I greatly appreciate it. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives. Yes, one sleeve at a time. Take care and God bless.